It is so imperative, even as we continue to create awareness about rare diseases, that we also talk about the empowerment of the patients and their caregivers. You will just find out in a moment why this is imperative and why a lot more patients and caregivers need to come out and embrace the information around rare diseases. And to help us along, we have Cynthia Oloch, who is the founder and board member of Primary Immunodeficiency Association Kenya. It is abbreviated as PIDS Kenya, right? Okay. And also joining us is Dr. Sam Guer, who is the Executive Director at Afya Research Africa, and I also know him as a pediatric neurologist. Thank you for being part of this conversation. Cynthia, I'll start off with you. Rare diseases is a reality that you have lived. Give us an idea of what this has been for you.
So for me, I lost a son, my firstborn, to a rare condition. When he was born, well, I would say that I was told I had a healthy baby, right? And as you mentioned earlier, that rare diseases can take 5 years to diagnose. Well, my son did not have 5 years. He only lived for 6 months, and in those 6 months, we didn't have a diagnosis. So he passed away undiagnosed. We came to learn what he had at the autopsy stage. So the post-mortem revealed that he had genetic disorder of the immune system. So he couldn't fight diseases. Yeah, so small things would get him down. So yeah, he passed away at 6 months of age. And at that point is when we realized that, well, I also had a younger brother. Our last born also passed away undiagnosed at 1 year. I was a kid then, but you see, when my son passed away, now this starts coming up that there's actually a history. So our last born passed away undiagnosed, and I also have a cousin who passed away undiagnosed at 1 year again. So when we got the diagnosis at autopsy stage for my son, and we realized that it's a genetic condition, that's when I founded the association, because at the time there was not much information on primary immune deficiency disorders. That's what it's called. And an international patient organization reached out to me actually through the doctor who did the autopsy, yeah, and came up with the diagnosis. And the International Patient Organization, that's when I became aware that it actually exists out there, even though it had not been diagnosed in Kenya yet. And there are patients out there living with it, adults who have grown up, you know. So my son did not have to pass away. It's actually treatable, can you believe it? It's actually treatable what he had, but since he was not diagnosed, couldn't be treated, and he passed away. And I'm told that it's treatable if diagnosed before the child is 3 months of age. After 3 months, the chances of success are lower, and chances of mortality are higher after 3 months of age. So that's my story with in the rare disease space. Yeah.
Now, Dr. Guer, earlier it has been mentioned that the importance of having infant diagnosis or diagnosis at birth is so critical, especially in the rare diseases space.
In Kenya, being the low middle income country that we are, I'm not aware that we have a consistent screening for any disease at birth. Beyond what we will do with the clinical observations. So there are expectations on what your attending nurse or your attending doctor should be able to look out for, but we do not have a deliberate genetic or biochemistry test. And what's available is really provided at private healthcare spaces, but for the general public, no.
And of course, even for it to be given, there needs to be information of, as you're saying, the existence of this condition that you suspect is ailing the patient. Let me get back to you, Cynthia. When you go back in retrospect, and of course from your research and those others that you've met in the international scene, what is the ideal situation and what are the outcomes?
I would say that the ideal situation would be what Rosalind mentioned earlier, newborn screening. But like Dr. Guer has said, there's no newborn screening in Kenya for any condition. Yeah. And I'll just give an example. So with my son's condition, he should not have been given the BCG vaccine because it's a live vaccine, and he has a compromised immune system already. So the BCG vaccine gave him TB. He reacted to the vaccine. So when I had my second born, who was born after I lost my first one, the pediatrician decided not to give him that vaccine until we are sure he does not have a compromised immune system. Thankfully, he doesn't. So that was good. But since we don't have newborn screening, if we did, then we would have known right from the beginning that this child should not get the BCG vaccine, for instance. Because then he got what they called disseminated BCG, like, I don't know what you call it.
BCGiosis?
Yes. Yeah.
Okay. All right, Dr. Ari, at this point, please tell us what this condition is and how exactly it comes around.
Well, it's to just have an idea of how vaccines work or are made. And in this case, BCG and other live attenuated vaccines are really a bug that has been slightly weakened so that then they get to infect you, if I can use that word, and induce an immune response so that if you get the real stronger bug, you're able to fight it. So in this case, if your immunity is much weaker, then it means even the live attenuated one, the weakened one, can still wreak havoc, as was the experience with your child.
And Dr. Guerre, I read on this and it says these children that are born with this condition are highly susceptible to any form of infection. Explain that to us.
So essentially, there are various components of your immune system that help you to fight infections. There are the cellular components, which really are like soldiers that will fight particular bugs, whether it's bacteria or viruses. And then you've got antibodies, which are proteins that will really to stick to foreign organisms. And in this case, what I have an impression of is you have a deficiency of one of those components and therefore capability to fight. It could be that, or maybe you have the soldiers, yes, but they don't have the weaponry or the systems to fight that. I think an immunologist will speak better to this. Yes.
Okay, now it sounds like, I mean, every parent knows when children are born, they are immunocompromised, and you literally have to start boosting the immune system even as they grow up. And that's why under fives are very critical when it comes to the healthcare space. If you had the information you have now today, what would you have done differently?
What I would have done differently is, first of all, trust my gut. I actually knew from when the baby was about a month old, something was wrong. I couldn't pinpoint it, and I would keep going to the doctor because as a new mom, you don't know what is normal, what is not.
Yeah.
So I kept going to the doctor and telling him something was wrong with this baby. Constantly throwing up, very fussy, very, he had some rash which was not going away, nothing major, yeah? But the doctor kept saying, you know, it's normal, like it'll go away on its own, it clears on its own. It never did for months and months and months, it never cleared. So by the time I was changing doctors, when the baby was a few weeks shy of 6 months, is when the new doctor told me, your baby actually needs to be in the ward, because just by looking at him, I can tell he's unhappy, I can tell something's wrong, I don't know what, but tests need to be run. So not a single test had been run all this time. And I kept going saying something is wrong, because I didn't know what was wrong, but no tests were run. So I would trust my gut and insist on tests to be run. I mean, prove me wrong that nothing is wrong, yeah? And I would also say that it helps to go with someone to go see the doctor. I was going alone, actually, to see the doctor. Sometimes it helps to not be alone at such, when you go see the doctor, because as a mother, you might get overwhelmed by what is happening to the child. So it helps to have someone with you who is not getting as overwhelmed as you and is able to manage the situation and maybe insist on what you need to get done and insist on just the dialogue with the doctor and ensure that you're basically being an active participant in the management of the care of this patient. Yeah.
And Dr. Guerre, I pick up on the frustration of a parent who knows something is wrong with their child, but when they tell the doctor who says they know if there was anything wrong, they just don't believe them. So even as we're talking about patient empowerment, how do we go around this?
Well, awareness is critical, but as you could see from Cynthia's experience, she had siblings who had passed on, so this did not start with her. An awareness that they had something happening. And the reality is it's not straightforward sometimes. And the advantage that I have, for instance, as a consultant, is that certain patients come to me having gone through other doctors. So I have the advantage of seeing what has worked before, not worked before. So it's not, I would say, not a unique situation in this country, or rather all over the world. There will be similar difficulties in figuring out the diagnosis. But that said, I also appreciate the parents are the first doctors for their children, because they know what is right, they know what is wrong. They are always spending time with their children. So by all means, you want to listen to a parent when they raise concerns about their child.
Now, Cynthia, with your work at PEDS Kenya, perhaps have you come across women who don't have the privilege you have to Google and get some of this information, and perhaps even access to education is a challenge? So you can imagine being a caregiver to a child who has something that no one can recognize. How do we uplift these parents and caregivers?
I would say that one way of uplifting such parents and caregivers is encouraging them to join either a patient support group or just, and the patient support group does not have to be of patients with the same condition, because there's a lot of similarities in the rare disease space. People face similar challenges with the different conditions, yeah? So it helps to have support of a community, yeah? Because there you get, again, information. If you need specialists in a certain area that you may not know where to start, the rare disease space has many people who've dealt with many specialists, and you can get advice on who to approach on what area, for instance. We actually have an Africa-wide WhatsApp group for primary immunodeficiency affected patients in Africa. It's a WhatsApp group. And most people, even in the villages, have access to WhatsApp these days. So you get people consulting in the group, or just sharing experiences and getting that support in terms of you're not alone. And it just gives you the motivation to keep going and keep looking for better management solutions for the patient suffering from this rare condition.
And remember that hashtag is Rare Disease KE, even as we speak about the different ways we can empower the patient and by extension the caregivers also who walk this journey with them. Any questions or comments about the same are very welcome. Again, that hashtag is Rare Disease KE. And Dr. even as we talk about the empowerment of this patient, there are some that could be willing to go seek intervention from the doctor, but they cannot afford it. In itself is a huge impediment. What can we do better?
Well, that's where universal healthcare comes into place, that you hope that everybody, irrespective of your socioeconomic strata, you can access the best possible quality of care. And even so, you also wish that there is appropriate awareness of the various diseases that are in our space, and that there is an opportunity for the government to put in resources to diagnose and manage these conditions.
Now, Cynthia, actually, Pamela here is saying, please talk about the importance and the value of a second opinion.
That is an excellent point. And even just speaking from my own experience, I stuck to the same doctor for 6 months without seeking a second opinion. The minute I sought a second opinion, this doctor looked at my baby and suspected a primary immunodeficiency. Without running any tests, he suspected and told me, you need to get your baby admitted today. My baby died 10 days later, 10 days. So for 6 months, I was seeing the same doctor. So a second opinion is so critical, especially in the rare disease. Because, I mean, they're rare, and it's rare not just to us patients, but also to doctors. They don't see this every day, and maybe you might be the first case this doctor is seeing. So a second opinion, I think, is critical, especially with respect to rare conditions.
And perhaps at your work at PEDS Kenya, what are you doing to sensitize caregivers? Because you could be seeing it, but also wishing it away, thinking is just whatever else you've had, it could be as a symptom.
And again, I say that's why it's important to join a support group, because you might be wishing away something which someone else has experienced and knows it's serious, yeah? And in our group, we actually have a mother who had a baby with a primary immunodeficiency after mine had passed away. And doctors actually gave her my number because she did not believe her son was sick. And doctors gave her my number and told her, talk to this mother. She's gone through what your son has gone through, you know, and then she understood it's actually serious. And I told her, you're very lucky, you know, your doctors have picked it up and have given you a course of, you know, treatment management for your son. I didn't have that. And I also told her, you're lucky you have someone to talk to who's gone through the same thing. So sometimes, and I mean, kudos to doctors who are doing that now. I actually have a number of people who have been referred to me by doctors. You know, just get her experience and understand that this is real, like, and it's critical, you know, because my son looked fine apart from the rash. He looked, and he was hitting his milestones. So mothers will wonder, I mean, my son is growing. He looks fine. What do you mean he has a critical condition? Yeah, because she's gone to hospital for something you think is minor, but it actually isn't. So yeah, I think it's critical to have a support system, a support group, and just to encourage doctors to also recognize that there are patient support groups which can help them in helping their patients properly manage the condition. So the doctor will not give me a patient's details, for instance, because of the confidentiality, but they can give the patient my number. So the patient, my number or anyone else in the rare disease space. So the patient is the one to reach out for the support that they need.
Dr. Guer, talk about the impact and perhaps the role of acceptance of these conditions, first as a caregiver or as a patient, as a first step towards empowerment, because some of these conditions come with a certain lifespan attached to them. And if this patient or caregiver does not accept it, then perhaps the outcome of the treatment might not be as good as the next person.
That's true. That's a challenge. And usually our experience has been that many patients are in denial the first, when you first get the diagnosis. And part concern is that the potential adverse outcome is so grave that you really want to put your head in the sand. I like the fact that other doctors have been referring patients to you for the simple reason that meeting other people who've had similar experiences is really critical in embracing that diagnosis. Because the reality is it's a difficult situation to be in. And you wish that, you want to be sure that you've gotten it right from the word go. So,
yeah. Okay, even as we bring this to a close, Cynthia, just an encouragement for others perhaps that have tried their best but have lost their children in the journey, and what more needs to be done to ensure that you also stand as an RD fraternity?
I would like to say that like for people who, for me, we are a number in the PID community who've lost our children. Actually, our WhatsApp group, I was telling someone today, we only have 2 people whose children are still alive. Most of us have lost our children, but we are still there because there's hope, you know. Like now, there's more awareness than I lost my son 4 years ago. So there's increased awareness, and babies are living longer. I've met someone, maybe not in Kenya, but I've met a lady who was born with a condition my son had. She has a family, she's in her 30s, she's French though. So, I mean, there is hope. We just need to diagnose it early and manage it, you know. I know that there's a resources issue, but it is possible. It's possible to manage, and it's possible to live long.
Very well said. Cynthia Lord, she is the founder and board member, Primary Immunodeficiency Association. Kenya, thank you for giving us such a great highlight on what PIDS is in the first place and what it is that you're doing in the country to support those that are living this reality. And of course, Dr. Guer, who is a pediatric neurologist, and of course, he is the executive director of Afya Research Africa. Thank you for your time. We shall be engaging further even as we talk more about this. And something else that's normally attached to or goes hand in hand with patient empowerment is actually advocacy. When a caregiver comes out and says, this was my experience and this is what I think should be done better, a person living this reality will believe them more than a doctor talking about a medical paper or a medical research. So that is why this is so important, and we'll be talking more about advocacy and the role of the same in the RD space in a moment. We'll be right back.